California.
Judge Andrew Napolitano, Freedom Watch, Wednesdays, 2 p.m. on FoxNews.com. Martha, back to you.
Thank you, Trace. Dr. Paul, we're back to you now. You probably heard a little bit of our conversation about the testing of the tissues on Michael Jackson, and I'm sure you could weigh in. But here's what I'm interested in. I'm interested in your fellow physicians and the fears and concerns that they have that the president's proposals will become law. What will happen to their, let's say, typically single practitioner practice?
I think the bottom line is that already physicians are dependent for about half of their income on the government, either through Medicare or Medicaid, and we're running short of money for the government overall, but both of those programs are chronically short of money. So, for example, Medicare was predicted to go bankrupt after a certain period of time, but then we added the Medicare prescription drug plan, which added and brought up, the bankruptcy by maybe 5 years. But now we're talking about adding all these new people that the government will take care of. What it does is it brings to a head and pinches the money even more. And so every year right now there is a law that says there will be Medicare cuts to doctors. It's automatic. But what happens is every year for the last 5 or 6 years, the automatic reduction in physicians' payment has been voted and deleted at the last hour in December of every year. My prediction is that already with this passing and also with the budget fiasco that's going on, is that this year for the first time in many, many years, you actually have real cuts in physician pay through Medicare. There will be an uproar. There will be people who have the ability to quit seeing Medicare patients who will do so, and there will start to become some sort of two-tiered system in our country like they have in England.
We are chatting with Dr. Rand Paul here on Freedom Watch. Dr. Paul, the president wants universal health coverage. The White House estimates that about 40 to 43 million Americans have no coverage, whether it's because they're young and healthy and they think they'll never need it, or whether it's because they're poor and starving and they have to spend their money on other things, whether it's because the government has regulated competitive insurance products out of the market, whatever it is. If the number of people who are interested in becoming physicians may go down because the lack of financial reward in the practice, and if you're going to flood the market with 40 million more patients for whose basic care the government will pay at a substandard rate, what will happen to the medical profession, and what will happen to typical middle-class people like, say, I, who need an annual checkup and occasionally maybe something else from my physician? Will I be able to get it?
Right, and one of the interesting things that's driving this, it's all being driven by 46 million people who are uninsured. But the interesting statistic that you don't hear very often is a third of them make more than $50,000 a year. A third of them are eligible for Medicaid already and just haven't figured out how to apply for Medicaid. And 20% of them are non-citizens. So you have a huge chunk of this 46 million where the problem is either fixable or has another solution other than expanding government care. And then a large segment of these people are without insurance for less than a year because they're young and they're getting their first or second job. So really it's a fixable problem given the circumstances that we have, but instead we're going to use it as an excuse to go on to a much bigger government health care system. And you're right, the resources aren't there. So ultimately, people will not go into medicine. Young people will choose other careers. There will end up being shortages of physicians. But ultimately, there will be rationing of care because free care gets overused, and overused care then has to be rationed.
Why can't we have competitive insurance products in this country where if I want the Rolls-Royce of insurance policies, I can buy it? If I'm a pre-diabetic, I can go to a carrier that will offer a policy for people that are pre-diabetics, or if I'm a fairly healthy person, I can go to a lesser expensive policy because it's not likely that I'm going to need it. As the government, I know in New Jersey this is the case, government forced carriers to offer products for people that don't need them, which raises the premiums of everybody that gets insurance from that carrier?
Right. What happens is, like in 1994 in Kentucky, we passed a law that said everyone had to have pregnancy coverage. So if you were a 75-year-old widowed woman, they made you have pregnancy coverage. Some states require in vitro coverage. There were rumors that that woman that had 8 kids out in California had her in vitro coverage covered by the state. So we do ridiculous things by mandating coverage. But I, for example, have a $5,000 deductible, and I used to be with a big clinic of 60 doctors, but we were spending $12,000 for family coverage. I got a larger deductible, and for the last 10 years, I've been paying about $4,000 for family coverage. So I've been saving $8,000 a year. You make up for your deductible the very first year you switch. Some of people can do that, but a lot of people are mandated because the insurance comes through their employer, and they don't get the options of these higher deductibles. The other thing that limits choices is you can't sell insurance across state lines. Most insurance has to be sold within that state and licensed within that state, and that limits some of the choices they can offer.
Before I let you go, is there the same enthusiasm amongst bright young people to go to medical school today as there was when you went to medical school, as there was when your dad went to medical school? Or is the practice of medicine not as financially or even professionally or personally rewarding as it once was before the government began managing it?
Yeah. I think it is changing. I meet physicians every day who recommend that their kids not go. I think in my case, I love medicine so much that I would recommend it still for my kids. There's a lot of government hassle that we deal with, and more, and I think the government will be short of money. It pays less every year. Every year that I've been in practice, I've been rewarded less for doing the same things. And so that is a squeeze, and eventually we'll get to the point where people won't choose it as a career. But, I love, being able to remove a cataract from someone and allowing them to see better and to see the joy on someone's face. So I love just the practice of medicine and have to put up, unfortunately, with the government. But I sure wish we had an injection of capitalism into it instead of more socialism, which is, I'm afraid, what we're going to get.
Before I let you go, are there any rumblings, any news out of Kentucky politics that you might want to talk to us about?
We announced about 20 minutes ago that with regard to my running for the U.S. Senate, I've been saying I won't run against Jim Bunning. Now I'm telling people that because it's so uncertain what he's going to do, that I'm considering and will probably make my decision in the next month on whether to do a full official campaign, no longer based on whether he stays in the race, but just simply based on whether or not we have the funds and the campaign structure to run. We haven't announced yet that we're doing it, but we did say today that we will make the announcement within the next month.
All right. It's Wednesday this week, and we're talking about this. And, of course, even though you and I are having a conversation between friends, there are millions listening to us. This is news that Dr. Rand Paul is now considering putting his hat in the ring for the Republican nomination for the United States Senate in the state of Kentucky, whether the incumbent, Jim Bunning, enters the ring or not. Do I have that right?
That's exactly right, and that's a change from what we've been doing, and the reason we feel like we have to change and reconsider our previous strategy is we've had many examples of congressmen and senators who play a game to the very last minute, and our local congressman did this. With 1 hour to go, he pulled his papers out to run for office and stuck his AIDS papers in his place. And then there's no primary, no debate. What I'm telling people is the Republican Party is shrinking nationally, and if we want to decide what direction the party takes, we've got to have a good, healthy primary, a good, healthy debate. And, for example, I tell them in the audience, I say, how many of you guys would have voted for the bank bailout? Not one person raises their hand, and then I follow up with that. 50% of the Republican leadership or more voted for the bank bailout. So you have to decide who you want to lead your party. Do you want those who bought the banks for the government to lead your party, or do you want a new crop of leadership in Washington?
The website is randpaul2010.com. Dr. Rand Paul from Kentucky, thanks very much for joining us. Until the next time on Freedom Watch, it'll be our pleasure to have you back again.
Thank you, Judge.
Thank you.